Every year, an increasing number of students report anxiety, depression, and chronic stress. These students follow up to graduate high school without learning how to properly manage their emotions or cope with their mental health. Public high schools should have a required mandatory mental health education system in place. Oftentimes, students can feel emotionally unprepared for the real-life struggles after high school. These skills can easily be implemented as it has seen that early mental health education can help to improve long-term well-being. There has been a lot of information and research to show how important this topic is. According to the World Health Organization and Deborah Schroeder, mental health education often helps with prevention, coping skills, as well as boosting one's emotional awareness. Today, I will be discussing firstly the current problems with mental health education in schools. Secondly, I will be discussing my proposal, which is the Student Mental Health Wellness Education Initiative. And thirdly, I will be discussing how my proposal is both beneficial and practical. To begin, the current systems of mental health education in schools are overall very inconsistent and just not as strong as they should be. Oftentimes, schools don't have this type of curriculum, and students can feel emotionally unprepared, and that can later lead to worse mental health outcomes in life. When schools don't have these kinds of curriculums, students have to depend on the very limited information that is given to them by their school district or their teachers on the topic of mental health. According to Imran Nadir, teachers have reported that they often too get very limited training on mental health systems, and this can be difficult for educators or teachers trying to express early support to a student in need. Oftentimes, this lack of structure can lead to a lack of mental health, um, mental health literacy. And what that means is that students don't know how to recognize symptoms of anxiety or depression within themselves, and much less they don't know how to recognize it within the people around them. So they have a difficult time asking for help or knowing when to ask for help, as well as coping with their mental health. According to Chan Mei Kai, adolescents develop their mental health in different stages. So students go through very high and very low psychological awareness and psychological well-being throughout high school. Now that I have explained the problem with the current system, I will be explaining my plan or my proposal. This plan would incorporate mental health education into existing health classes, and it would cover topics of stress management, emotional awareness, and coping skills for one's mental health. This plan or this curriculum would be completely created by counselors and psychologists, and it would be standardized at a state level. According to the World Health Organization and the Copenhagen Consensus Center, school-based mental health programs should and can be integrated into school systems as they improve early intervention. Teachers would receive training from medical professionals, and this would help them also recognize and respond to students' needs in the appropriate manner. According to Imran Nazir, teacher training can help improve identification of a student's mental health. And now that I have explained the solution or the plan, I will move on to my third main point, which is why this plan would work, why it's practical, and why it's beneficial. This plan is practical because it fits into existing classes and into existing student schedules without having to make huge changes into a curriculum. According to Fatime Karime, better mental health is often linked to improved academic performance in students as well as a reduced procrastination rate in high schoolers. This policy would not require extra graduation credits or major schedule changes, so it reduces the amount of stress that students already go through in high school. According to Chan Meikai, structured mental health support improves long-term emotional stability. Students would benefit socially and emotionally from this type of plan, and they would learn coping skills on stress management and on their emotions, and it would reduce the overall stigma that is often around mental health. In conclusion, mental health education is an important part of preparing students for the real world and for their life after high school. Today, I have explained the problem with the current mental health education system. I have explained my plan or proposal, and I have explained why this policy is both practical and beneficial. I believe schools should integrate mental health education into classes so that students can develop these kinds of coping skills and this kind of emotional awareness. I also believe state boards should support this kind of standardized curriculum and this kind of training so that schools can properly introduce this type of program to their students. Mental health education is a very realistic and very practical reform, and it builds emotional resilience. It reduces the stigma around mental health, and it oftentimes improves a student's well-being. Thank you.